Medical and psychiatric social work. Medical social work. Concept of medical social work. Medical social work is a specialized branch of social work that focuses on supporting patients and their families in coping with the social, emotional, and financial challenges associated with illness, injury, disability, and hospitalization. It operates within medical settings such as hospitals, clinics, rehabilitation centers, and community health organizations. The primary goal is to enhance the well-being and quality of life of individuals by addressing the psychosocial aspects of healthcare. Evolution of medical social work. The origins of medical social work can be traced back to the early 20th century in Western countries, especially in the UK and the USA. In India, it began gaining recognition in the 1940s with the establishment of social work departments in hospitals. The development of medical social work has been influenced by the integration of public health and welfare services, the increasing need for patient-centered care, and the recognition of the social determinants of health. Key milestones. Early 20th century, initiated in England and the USA with the hiring of almoners to assist poor patients. 1946, establishment of the first medical social work unit at JJ Hospital, Mumbai. Post-independence India, expansion of medical social work education and practice. Recent trends, emphasis on community-based rehabilitation, mental health, and chronic illness management. Role of the medical social worker. Medical social workers play a multifaceted role in addressing the needs of patients and ensuring a holistic approach to healthcare. Their major responsibilities include counseling, providing emotional support to patients and families, helping them cope with stress, grief, trauma, chronic illness, and terminal conditions, addressing mental health issues such as anxiety and depression, care planning, collaborating with medical teams to design discharge plans, coordinating post-hospital care, home-based support, and rehabilitation services, ensuring continuity of care and follow-up services, financial assistance, assisting patients in accessing government and NGO financial aid schemes, guiding on medical insurance, subsidies, and payment plans, facilitating connections with charitable organizations, assessment, conducting psychosocial assessments of patients and their family environments, identifying risk factors and barriers to recovery, developing personalized intervention strategies. 5. Advocacy. Acting on behalf of patients to ensure they receive appropriate care. Addressing issues of neglect, discrimination, or abuse in the healthcare system. Promoting patient rights and equitable access to services. 6. Legal assistance. Guiding patients on legal matters related to healthcare such as medical negligence, domestic violence, or guardianship. Referring to legal aid services when necessary. 7. Education on nutrition. Collaborating with dietitians to educate patients on disease-specific dietary needs. Promoting nutritional awareness in underprivileged communities. 8. Personal hygiene. Teaching patients about the importance of hygiene in preventing infections. Promoting hygienic practices, especially in rural or slum areas. 9. Water and sanitation. Educating communities about safe drinking water and sanitation practices. Supporting public health campaigns related to clean water and waste disposal. Functions and responsibilities of medical social workers. Medical social workers perform a vital role within healthcare settings by addressing the social, emotional, psychological, financial, and legal issues faced by patients and their families. Their work is grounded in the principles of holistic and patient-centered care. 1. Psychosocial assessment. Conduct comprehensive assessments of patients and their family situations. Identify emotional, psychological, social, and environmental factors affecting the patient's health and recovery. Document and communicate findings to the medical team. 2. Counseling and emotional support. Provide individual and family counseling to help cope with illness, trauma, or loss. Offer mental health support for issues such as anxiety, depression, grief, and adjustment disorders. Help patients understand and accept their medical condition. 3. Care planning and coordination. Participate in multidisciplinary teams to create effective discharge and care plans. Coordinate with community services, rehabilitation centers, home care providers, and NGOs. Ensure continuity of care after hospital discharge. 4. Patient advocacy. Advocate for patients' rights, dignity, and access to healthcare services. Intervene in cases of patient abuse, neglect, or discrimination. Represent patients' interests in decision-making processes within the hospital system. 5. Assistance with financial and social resources. Help patients access government schemes, insurance, and NGO aid for medical expenses. Provide information on social welfare programs such as disability pensions, old age benefits, etc. Assist in fundraising or arranging charity support when necessary. 6. Legal aid and documentation. Guide patients and families in understanding legal rights in healthcare, e.g., consent, confidentiality, end-of-life care. Assist in preparing legal documents related to guardianship, adoption, or medical negligence. Refer cases to legal aid clinics or organizations when needed. 7. Health education and awareness. Educate patients on disease management, treatment adherence, and self-care. Provide guidance on nutrition, hygiene, safe drinking water, and sanitation. Conduct awareness sessions in hospitals and communities to promote public health. 8. Crisis intervention. Respond to emergencies such as accidents, suicides, or family breakdowns. Provide immediate psychological first aid and emotional support. Arrange urgent resources or referrals during critical situations. 9. Documentation and record keeping. Maintain accurate records of patient interactions, assessments, and interventions. Prepare reports for the medical team and for administrative or legal purposes. Monitor patient progress and outcomes over time. 10. Research and program development. Engage in research activities related to healthcare social work and patient outcomes. Contribute to the development and evaluation of health programs and policies. Promote evidence-based social work practices within medical settings. Psychiatric social work. Concept of psychiatric social work. Psychiatric social work is a specialized field of social work that focuses on addressing the psychological, emotional, and social needs of individuals with mental health disorders. It involves applying social work methods and psychiatric knowledge to support individuals, families, and communities in coping with mental illnesses and promoting mental well-being. Psychiatric social workers collaborate with psychiatrists, psychologists, nurses, and other healthcare professionals in both clinical and community settings. Their primary aim is to ensure holistic care for persons with mental illnesses by addressing not only medical needs but also social, familial, and environmental factors. Evolution of psychiatric social work. Global evolution. Early 1900s, the need for psychiatric social workers emerged with the rise of mental health services in the West. 1911, Mary Jarrett, considered a pioneer, worked in the Boston Psychopathic Hospital and emphasized the need for trained social workers in psychiatric care. Post-World War era, increasing cases of war-related trauma led to expanded mental health services and a recognized role for psychiatric social workers. 1960s, 70s, shift from institutional to community-based care boosted demand for psychiatric social work. Evolution in India. 1946, establishment of the Department of Psychiatric Social Work at the All India Institute of Mental Health, now NIMS, Bengaluru. 1950s, 60s, start of formal education in psychiatric social work, e.g., MSW with a specialization in psychiatry. Post-1980s, expansion of roles into schools, courts, correctional institutions, and community mental health programs. Current trends. Emphasis on deinstitutionalization, community-based mental health, rehabilitation, and awareness. Role of a psychiatric social worker. 1. Evaluation and estimation. Conduct psychosocial assessments of individuals with mental illness. Collect information on family background, social environment, past trauma, and behavior patterns. Identify factors contributing to mental health conditions, e.g., poverty, substance abuse, domestic violence. Estimate needs, risks, and readiness for treatment or rehabilitation. 2. Making treatment plans. Collaborate with psychiatrists and mental health teams to prepare individualized treatment plans. Ensure treatment plans address both clinical needs and social support systems. Include objectives related to medication, therapy, family involvement, employment, and community reintegration. 3. Intervention during crisis. Provide immediate psychosocial support during psychiatric emergencies such as suicidal behavior, psychotic breakdowns, or trauma. Coordinate hospitalization, temporary shelter, or crisis intervention services. Support family members in managing acute situations. 4. Providing treatment and services. Offer individual and group counseling, psychoeducation, and behavioral therapies. Provide support in managing daily functioning and social skills. Assist in accessing welfare benefits, housing, vocational training, and legal aid. Engage in family therapy and community reintegration programs. Functions and responsibilities of a psychiatric social worker. A psychiatric social worker is a trained professional who supports individuals with mental health issues by providing psychosocial care, counseling, rehabilitation, and advocacy. Their functions go beyond clinical work and include addressing the emotional, social, familial, and legal aspects of mental illness. 1. Psychosocial assessment. Evaluate the patient's mental, emotional, social, and environmental conditions. Gather information about family history, employment, substance use, and past trauma. Identify social factors contributing to mental health problems. 2. Treatment planning. Collaborate with psychiatrists and mental health teams to develop individualized treatment plans. Include therapy goals, support systems, rehabilitation needs, and community resources. Monitor and review treatment effectiveness over time. 3. Counseling and psychotherapy. Provide therapeutic interventions such as individual counseling, group therapy, and family therapy. Help patients cope with anxiety, depression, stress, schizophrenia, addiction, and other disorders. Promote self-awareness, emotional regulation, and behavioral change. 4. Crisis intervention. Respond to emergencies like suicide attempts, violent behavior, or acute psychotic episodes. Offer immediate psychological first aid and stabilization support. Arrange hospital admissions, protective custody, or emergency shelters if needed. 5. Rehabilitation and reintegration. Help patients regain functional abilities for daily living, work, and relationships. Facilitate vocational training, employment assistance, and life skills development. Support reintegration into family and community life after treatment. 6. Family education and support. Educate family members about the patient's condition and treatment needs. Provide emotional support to caregivers dealing with stress or burnout. Promote a supportive home environment. 7. Legal aid and advocacy. Assist with legal procedures such as disability certification, guardianship, or court cases. Advocate for patients' rights, dignity, and protection from stigma or abuse. Liaise with legal aid services and NGOs for further assistance. 8. Community outreach and education. Organize awareness programs on mental health in schools, workplaces, and communities. Reduce stigma and encourage early detection and treatment-seeking behavior. Promote mental health policies and public welfare schemes. 9. Documentation and research. Maintain accurate records of patient assessments, therapy sessions, and progress. Contribute to research studies and program evaluations. Use evidence-based practices to improve mental health outcomes.
Thank you so much for watching. Don't forget to like, share and subscribe. See you in next video.